Last year, we bestowed 2 Global Health Justice Awards. One to the amazing, and I think now that you've heard a little bit about him, you'll all agree, the amazing Dr. Alan Berkman, whom we are proud to have named an award after. The other hero is Dr. David Hughes. David Hughes was one of the early leaders of HealthGap, using his role in government to push out information and extend resources, including allowing a group of ragtag activists to get into the AIDS Institute, formal conference room and meet. That's what we're talking about. Now he is officially, and quite literally, I hope, he's quite literally right there, okay, quite literally on our side. Yay. Implementing life-saving treatment and prevention programs throughout sub-Saharan Africa. Dr. Hughes has spent a great deal of time in South Africa, so it is fitting that he joins us at the podium for the next presentation.
One of the great things about all of our presenters tonight is that they're all women, and women who deserve awards in their own right. And our next presenter is no exception. I'm not talking about David. Maybe. I actually came of age in the 1980s. Gay rights activism in Thatcher's Britain, the beginning of the AIDS epidemic, and against the background of what some of us would argue is the best bloody music of our time. At the forefront of that music was an incredibly gifted artist and humanitarian. Ladies and gentlemen, it's my honor and privilege to introduce Annie Lennox. And of course, I'm proud to say, a fellow Brit. Unfortunately, as you can see by now, Annie couldn't be here in person tonight because she's busy in the studio, but she has prepared this video statement.
Okay. Several years ago, I was attending a dinner that was given in honour of Nelson Mandela in George of the Garden State. It was a very fancy dinner, and everybody was wearing very fancy clothes, except for one man who was sitting at a table wearing a t-shirt like this. Well, it was a little similar to this, but it said HIV positive on the front, and I was intrigued. I wanted to know who this man was. So I asked someone to introduce him to me, and of course his name is Zaki Ahmad. That was the beginning of my introduction to the Treatment Action Campaign. I met Zaki. I was very impressed with the work that he had done and is doing, and I found out about Treatment Action Campaign, and I said, this is the kind of organisation I want to be part of. I want to be an activist for HIV and AIDS. So I joined Treatment Action Campaign. I am a member, and I'm very proud to be part of the organisation. I think that TAC have been extraordinary, and the work that they do, is absolutely exceptional and really life-changing in communities in remote parts of the country where people are really having to struggle with the HIV pandemic, in places in inner towns. The whole spread of TAC across the whole country of South Africa is quite amazing. I am honoured to be a member of TAC, the people at the front line of the struggle against HIV and AIDS. So, to cut to the quick, on behalf of HealthGap, I'd like to give the honour of Global Health Justice Award to the Treatment Action Campaign.
Well, I'm pleased to follow Annie Lennox, and actually I'll be doing karaoke to some of her tunes afterwards. First of all, I just wanted to, maybe just before we move to the award, just acknowledge that thank you. I just want to acknowledge that we're being hosted at a service workers union building, and in this frightening sort of reactionary time, I just want to acknowledge that what a great thing that we're being hosted. And also I wanted to just acknowledge again and thank everyone for being one of the recipients last year of the Global Justice Award. And the work that I've been doing for the last 8 years, which has been involved in supporting HIV care and treatment programming, would not have been possible without the work that Health Gap, as well as the recipients of this next award. None of this work for access, for actually providing treatment would have been possible without the advocacy work that was done. I've been consistently inspired by the Treatment Action Campaign, since its inception in 1998. With more than 16,000 members, 267 branches, and 72 full-time staff members, the Treatment Action Campaign has become the leading civil society force behind comprehensive healthcare services for people living with HIV in South Africa. Since 1998, TAC has held governments accountable for healthcare service delivery, campaigned against official AIDS denialism, challenged the world's leading pharmaceutical companies to make treatment more affordable, and cultivated community leadership on HIV. The Treatment Action Campaign has also been an inspiration for community-based activism throughout Africa in a way that our work in the U.S. could not have had the same impact. The work that Health Gap collaborated from the very beginning with the Treatment Action Campaign, but I think it really crystallized at the International AIDS Conference in 2000 in Durban, where despite perhaps some ruffled feathers, important collaborations were reinforced. And I think for those of you who remember, at the AIDS Conference in 2000 in Durban was the first international march for treatment access, co-sponsored by the Treatment Action Campaign as well as Health Gap. I'd like to present this award to Nompumelelo Margaret Mantangana, affectionately known as Sis Impumi. Sis Impumi has been a member of TAC for the last 10 years. She's been working as a nurse for 20 years and is now working at the Ubuntu Clinic in Khayelitsha, a township, an informal settlement and township in South Africa, in Cape Town, in the capacity as operational manager. Ubuntu Clinic is an integrated TB and HIV clinic, which was the first community clinic to provide patients with antiretroviral drugs in 2001 through the non-governmental organization Médecins Sans Frontières, or Doctors Without Borders. In 2000, she was the recipient of the Cecilia Makawani Award in recognition of the role that she plays in HIV care and primary health care. I just want to mention that we've been working in Cecilia Makawani Hospital in the Eastern Cape for years, and I just found out tonight who Cecilia Makawani is. And so I just wanted to mention, and please correct me if I don't have this right, that Cecilia Makawani was the first Black African nurse registrar in South Africa. And so I think the fact that Impumi received that award is an incredible honor. She's played an important role in primary health care, in the struggle for providing services for people with HIV as a healthcare worker, as a TAC activist, and as a role model for other nurses. So I'd like to invite her up to please accept this award.
Thank you.
Thank you.
It's an honor for me to be here as a member of Treatment Action Campaign. It's a pity, I'm alone, but we can make that noise. Amanda! Viva Treatment Action Campaign, viva! Viva! Viva Action Treatment Campaign, viva! Viva! Viva MSF, viva! Viva! Viva Health Gap, viva! Viva! Viva the Friends of Treatment Action Campaign internationally, viva! Viva! Thank you, Amanda! Away too! That's how we share the pain in South Africa. When we are paining, we rejoice, we sing. When we are happy, we sing. I'm very humbled to be standing here as a TEC member, and I'm very humbled that TEC, you have heard in the video that TEC is having 16,000 members, and I was nominated to come here and receive the award, this special award for TEC, and I'm really truly grateful to be here today. TEC started in 1998. We were frustrated. I am working as a professional nurse now for 20 years. During our training times, we never heard of HIV and AIDS. We only hear of HIV and AIDS whilst we were working as professionals. And that was way back in 1998, 1999. And we get so scared and scary because nobody knew really what to do at that time. And in 1998, people like Zaki Ahmad, as Annie was saying, stood up. And we were real tired of keeping quiet, or we were real tired of quiet. Then they formed the Treatment Action Campaign. Whilst the Treatment Action Campaign was formed, we didn't really have an actual picture of what we wanted to do. But we really wanted to understand what HIV is all about. And we wanted treatment, because we did hear that there's no cure for HIV, but there was a treatment in the first world. And we are in South Africa, that is the third world, we didn't have access to treatment. So that's why we started to mobilize. I joined Treatment Action Campaign due to desperation and frustration, because I was working as a nurse testing people, encourage people to come and test for HIV and AIDS. When people test positive, then what? You don't have anything to offer them. Then that's when I decided to join Treatment Action Campaign, because I wanted to know more about HIV and I wanted to help my people in South Africa in HIV and AIDS. Then Treatment Action Campaign started to push the government. We really have no option but to push. And when we are pushing, we went out to the streets. We do all the funny things that will embarrass our government. Because by that time, South Africa was really in denialism. Our president, knowing fully well that according to the statistics, South Africa has the highest number of people that are infected with HIV and AIDS. And he said on public television, he have never seen somebody with HIV and AIDS. And to us, that was the sad day, because we, at the grassroots level, were burying people on a daily basis. There were funerals on a daily basis. So TEC have to take to the streets. And we push the pharmaceutical companies to drop their prices, because we had campaigns where we were saying in the campaigns, put lives before profit. Because the companies were profiting out of our misery. At the end of the day, people were still real suffering in South Africa. Then in 2004, with the help of MSF and our international family organizations like GAP, in 2004, we started to have a program, a rollout of antiretroviral drugs by government. That was a milestone. Then in 2008, that's when our denialism era ended. then that's when we started to really see patients, put patients on antiretroviral drugs. It's still not real more, it's not much, but at least we are doing what we can from the public sectors, because in the olden days there was no antiretroviral drugs in public sectors. Then in 2009, our government pledged that starting from April 2010, we should be putting patients on antiretroviral drugs, pregnant women with a CD4 count of 350, TB patients with a CD4 count of 350. That was real ambitious, but we are trying to get there, because we all know that in 2008 the world experienced recession, but they tend to forget that one thing that is not in recession is HIV and AIDS, because HIV and AIDS is not in recession. So we have to plead with the rich countries not to pull back with their funds. They should be putting funds for the global health, so that, you know, the programs that have been started, we would know that we are reaping fruits at the end of the day. But by cutting down funds, it puts us back to square one, where we started. Because in South Africa, we still have to lobby. So health gap and X up, you still have to be out in the streets. In South Africa, we have got only 2 lines, that is the first and the second line. Some patients are failing, the ones that have started in 2001 are failing the both lines now. And with those patients, we are still back to square one, because there's nothing to offer those patients. So we still need the international family to help us to put more pressure on our pharmaceuticals companies and on our government, you know, to understand that HIV, it's not only 2 lines. There are various options for patients, but in South Africa, that one, we don't have those options. When I am going to say the last word, 2 weeks back, I read in the paper, it was bold in the Times, that we, as HIV activists, we are working. The ARV program is working, because we are putting people out of business. The funeral parlors were complaining that you are putting them out of business. Viva ARVs, viva! Viva ARVs, viva! We still have to continue to go onto the streets, because we are at war. We have not reached our destination. We don't have a cure for HIV. There are still antiretroviral drugs. I want to thank again Health Gap for acknowledging Treatment Action Campaign, and thank you. I love you all.